Good afternoon. This is Dr. Ahrar MS Feroz. I'm a consultant physician and diabetologist. I have been having my own practice and been practicing for almost 15 years. Today, I'm here to talk about a very interesting topic, hypertension. Why it is very interesting? Because the other name given to it is a silent killer for a layman. See, what exactly is hypertension? Hypertension is the pressure created on the blood vessels with the stroke of our heart beating. So basically, to understand this, there has been 17th May has been assigned as a World Hypertension Day, which we try to help our patients in educating them and making sure that they come up, they get themselves tested, and make sure that they get themselves treated at the right time. See, why are we talking about hypertension? Because, and why it is known as silent killer? Why? Because it does not present with any signs and symptoms. Most of my patients, when they come to me, and when it is we who tell them that they are hypertensive, to the surprise of the patient, they will tell that they are very fine, they don't have any symptoms. For that particular reason, it is always we tell that hypertension does not have any signs and symptoms. In a very few rare cases, we will find symptoms such as headaches, blurring of vision, chest discomfort, etc., etc. But these are the basic things. But I will repeat, it is not seen in most of the patients, not seen in most of my patients for that particular reason. Now, the next question comes is, what is the normal blood pressure? So the normal blood pressure, the blood pressure has two variants, which is known as a systolic, the upper one, and the diastolic, the lower parameter. For a normal individual, any blood pressure more than 140 above upon 90 is said to be hypertensive. See, there are different categories. If we are trying to understand or to teach a medical student, we do have different parameters, different guidelines, such as pre-hypertension, hypertension, stage 1 and stage 2 hypertension. But for my patient to understand, I always tell that draw a line there whenever somebody has a blood pressure of 140 upon 90 for 3 consecutive reading in 10 days duration, then they should believe that they are having hypertension. What exactly happens if we don't treat hypertension? If we don't treat hypertension, it starts damaging our end organ, such as whenever there is high blood pressure, it will start affecting our heart, brain, eyes, and kidney. These are the very important things which we will understand. So hypertension can lead to heart attacks, hypertension can lead to blindness, hypertension can lead to renal failures, hypertension can lead to a hemiplegic stroke. So these are the things. That is why it is very, very important. And how are we going to do it? We should get inculcated and habituated to have tested our blood pressure very frequently. How frequently? Depending on if somebody is having a strong family history of hypertension, if the patient is an obese individual, if the patient is increasing in his age, that is crossing 40s, if he's a smoker or ethanolic, it is always better that he test his blood pressure on a regular basis. On a regular basis, then comes the question, what is the regular basis? At least twice or thrice in a month. What is the right time to take the blood pressure? I always tell them, do it always on different time, not on a specific time. Then comes, how are we going to measure it? It is very simple. We are going to do it with, these days, there are so many monitors which is easily available in the market. We can use them. Make sure that you consult with your doctor and buy a one which is very, very effective. What is the best sphygmomanometer? What is the apparatus? The apparatus used for this is known as It is a sphygmomanometer. There are electronic as well as manual apparatus available with us. Testing that is very, very easy. A patient used to have this. There are certain things which are very important when somebody is taking their blood pressure at a particular level. What are the things which they should keep in mind? First and foremost, whenever they are taking the blood pressure, the apparatus and the patient should be sitting in an upright position. The patient has to be sitting in an upright position. Make sure that his back is rested with an armrest or chair rest. The BP apparatus and the arm should be at one particular height. The patient should not sit with his legs crisscrossed. The patient should not have either his meal 1 hour prior to taking the blood pressure, or the patient should not drink any caffeinated drinks, cigarette, or alcohol 1 hour before taking their blood pressure. So these are the few basic things which an individual should keep in mind when they want to take up their blood pressure at home. So once they feel that the readings are more than 140/90 on 3 consecutive times in 10 days, then they have to report it to your primary physician. Now, what are the things which helps before getting treated, or if you feel that when it starts, what is the first thing you should start doing it? First and foremost, it is the exercise. I always tell, during this period, the sedentary lifestyles are the major concern of blood pressure these days. So very importantly, the patient should start involving in isometric exercises. There are 2 kinds of exercises, if you know. It is isometric and isotonic exercises. Isotonic exercises are where we use weights, dumbbells, and we do strenuous exercises. So isotonic exercises are to be avoided when somebody is thinking that they are coming on the borderline hypertension. They have to do isometric exercises where the whole muscles get involved, such as walking, jogging, cycling, swimming, etc. Basically, the exercise pattern has to be on a regular pattern. It has to start low and go slow. I usually see people doing it in very heavy exercise initially, putting a lot of time, and then landing up into injuries. So I always tell my patient or educate my patient to start slowly and make sure that you do on a regular basis. Second, coming to that is about the diet. What exactly we are looking for in the diet? So in the diet, what are we looking for? First and foremost, there's a DASH trial given for these. So what do you understand by the DASH trial? It has to contain mostly fruits, vegetables, nuts, and avoidance of unsaturated and processed foods. This is very, very important. Saturated and processed foods has to be avoided. And usually the salt intake has to be reduced to a minimum quantity. No additional salt is should be added to the meals. One very important thing these days is whenever we are going to take any processed food, make sure that you are seeing the label for the amount of sodium content in that. That is very essential. So once we start a proper exercise, diet, making sure if we have any habits and addiction, try to avoid smoking, try to avoid tobacco chewing. All these things have to be avoided. Coming to the last point is the medication. What is very important is once you feel that you are on the higher side, feel free to first report to your physician. Make sure that he'll assess you, he'll examine you, and then he will be giving you an antihypertensive pill. By taking that pill, you can bring down your blood pressure to the normal ranges. The only thing which you have to be very important is make sure that you are compliant with the medication. You have to properly take it as advised by your physician. If you feel that there is any kind of discomfort and things like that, you have to go back to your primary physician to make sure that the dose is adjusted. So this was a brief about hypertension. I think I was clear enough for you all. And whenever you feel, make sure, I am repeating again, this is because this is just a silent killer, and it will not give us any signs or symptoms until unless we get ourselves tested that we are having blood pressure. Thank you.